Hey, this is Dr. Ron Garry. I want to talk a little bit today about how we diagnose osteoporosis. Obviously, we know how common osteoporosis is, and if you haven't seen it, I've done a series on the epidemiology of that. But the way we tend to diagnose osteoporosis, obviously, if you've had a traumatic fracture, that gives you the diagnosis. Otherwise, we do it based on a bone density, and we use is dual energy X-ray, what we call Dexa Scan, which really is the gold standard. We tend not to do any of these anymore. And the Dexa scan measures your proximal femur, very useful in predicting fractures, and then the lumbar spine. They also measure your radius, but I find that clinically less relevant in predicting fractures. And so over here, you could see this is what a Dexa machine looks like. And so it's wide open for anybody who's claustrophobic. The computer here records the information, and it does basically an x-ray of your hip and your spines. It looks at the different vertebra, and it looks at this area here of your hip, and it kind of measures your bone density, and we use that to predict fracture. Remember, osteoporosis really is a microscopic disorder, and a bone DEXA scan is looking at it from a macroscopic view, kind of a 30,000 foot view. We do have some techniques to look more of at a microscopic level, but they're not ready for prime time, and unfortunately are quite expensive at this point in time. So when we look at a DEXA report, you can see it looks at the lumbar vertebra, L1, L2, L3, L4, and then it reports out the bone density, and it does it in grams. Obviously, as physicians, we tend not to use that. What we use is what's called a T-score and a Z-score. And so the T-score is your bone density compared to a 30-year-old. May seem unfair if you're 80 years old, but we know 30-year-olds don't break their bones. The Z-score is your age match, so they compare you to somebody of your own age. If you're 80 years old and they compare you to an 80-year-old, it doesn't really help us because 80-year-olds break their bones. The back can be misleading because you could have very good bone density there, in part related to a lot of arthritis that gets measured up. Remember, arthritis can make extra bones, and that can really mess up the bone density. When we look at the hip, you could see this is the area that it looks for of the hip. This is the femur bone, and this is where the ball and socket per se is of the hip, and it reports it out. You can see left neck, right neck, and again you get a T-score and you get a Z-score, and we use those to make the diagnosis. Remember, a T-score of -1 to -2.4 is osteopenia, and again, more negative than 2.5 and more negative is a definition of osteoporosis. Well, I thank you for your time today. Take care.